Mobility is a huge thing when it comes to preventing access. This man, there is no way he can clean his own teeth. There is just no way. This is not just arthritis. He could not even eat. He couldn't even lift that arm. But the mouth had a lot of issues. He had tons and tons and tons of cavities exposed sitting there, and he couldn't even brush his teeth. So be able to, for this man, I actually had to put I mean, you can see both hands, how non-functional they are. All I had to tell to his caregiver to not use toothpaste. Do not use toothpaste. Toothpaste is hard to clean out of their mouth. It's hard to rinse. It's hard to swish around for people that don't have the muscle strength to be able to do that. And that foamy thing, they just fight it. And it's not comfortable. They don't want to do it. Just dip the toothbrush in a mouthwash with fluoride. Any kind of mouthwash, any kind of fluoridated mouthwash, doesn't have to be a special brand, but to be able to brush their teeth with just the mouthwash, they don't have to rinse. It won't make him sick. They don't swallow anything. Just clean it, and that's it. That will do a lot of prevention work as they don't have access or financial ability or anything to go to dentists, or most facilities don't have dentists to come in. So prevention, you play a big role there. Is everything that doesn't look good diseased? No. This man could chew steaks on his whatever is left of the teeth. No infections, no mobility, no gum disease. All the teeth, as you can see, the roots are necrotic, natural, we call it natural root canal, no pain. He's eating. Those roots do not need to come out. We don't have to make him dentures. It's just, let's see if he's functional and has no pain. And that's all there is to it. They should be functional and have no pain. And as long as that's what they have, nothing needs to be done. But when they do have loss of function and they have pain and it's impacting their nutrition and everything else, we need to see that. Removable prostheses need to get cleaned. I mean, I keep putting that picture up because it was something I had never seen before. Just to be able to keep things clean, it keeps patients, individuals functional and pain-free. When they are not cleaned properly, when they are not removed properly, they do cause infections. They do cause a lot of problems. They do cause lesions. And the sad part is, as you all know, people that have other health conditions, they don't heal fast. The wound healing is a problem. So for someone with this kind of pain to be treated for 2 weeks, sometimes 3 weeks, to be able to not have the pain anymore so they can actually consume, be able to eat again, that's a long 2-3 weeks for somebody who's in pain in the mouth. Herpes zoster the case that happens in the mouth are very, very painful, very painful. And they can be prevented basically with proper oral hygiene. If the partial dentures are not fitted properly, if they are loose or they sleep with them at night, as impossible that it can be, they can swallow it. It gets stuck. It can actually cause a lot of problems. Actually, this person was, this picture was given to me by a ER physician. And then we have Again, when I showed that first picture, look under the gum, under the tongue, look into the cheeks, because you never know where the early oral lesion is, oral cancer lesion is. Oral cancers are 8% of all cancers and have the highest rate of mortality. The treatments are usually late stage, very invasive. After treatment, they may live 3 to 5 years, but the quality of life very low because it's very invasive to treat a late stage oral cancer, and they are very rarely are diagnosed on an early stage. And this case happened to be renal renal cell carcinoma. And at some point, it probably was just a little redness in the back of it, behind the teeth, closer to under the gum. So looking at in the mouth, just looking in the mouth with no expectation, no diagnosis, don't be afraid. Anything doesn't look good, note it. Again, as I said, the teeth do not have to be pretty to be healthy. And that's the most important thing. So here we come to the very, the meat of a presentation, I must say. The 4Ms has two workflow. We have the hospital flow and we have the primary care flow. And in both of these flows, age-friendly health system starts with intake into the care setting. And that's where you start to put them in the system. And I think that's where exactly oral health belongs. Look in the mouth. As simple as that. Ask a couple questions. Do you have to take your teeth out? Anything removable? Anything hurts? When was your last checkup? Just a couple very generic questions right in the beginning, kind of get a tongue depressor and look around. That's all it takes. It's just assessment, making a note. That's how individuals come in, and that's how you actually and clinically introduce oral health into the 4Ms. Here is our second. I figured after everything I told you, now I want to know, do you think oral health is missing in age-friendly health system and in our professional education? That's a good question. It's a fair question. So respond to that, please. So I don't know if I talked about everything that I wanted to talk about, but I think it was a great introduction. Just, hey, mouth is part of oral health. I mean, part of overall health. And a happy elderly is a healthy elderly and pain-free elderly. I probably don't have time with all the questions you may have, but please, this is my email. It's my name, mariam.tabrizi@uttmc.edu. So feel free to email me, ask questions. I promise I will respond to you. Maybe if not the same day, I will. If you send me pictures, you want to ask question on some specific case, I'll be more than happy. We here at UT, we have monthly tele echo sessions. If you go to our website, I'll be more than happy to have you on a team. If you come in with questions, with cases, that's all it's about. Tele echo is what group of healthcare professionals come together from all across discipline, not just dentists, all across discipline. And we look at everything in one individual, and we see what works best. So here we are, and towards the end, I hope I was able to give you a few tips that you may want to know, and just tell you that oral health is part of overall health, and it is part of a 4Ms, and it needs to be part, and it is not that needs to be, it is part of age-friendly health system. With that, thank you very much for your time, and hope I have more chance to talk to you later. Bye-bye.